May I show it on you?
Yeah.
Okay, great. So, on your front side. Where do you have the problem? Yes, please. Okay.
이 문제가
Where do you have the pain? Yes. And where? You said at the biceps. On the right side.
Yeah.
Okay. Please sit. First sit here. We make a little test. Now you press outside. It's okay? A little on the right side. Okay. Inside. It's okay. Up. And down. Outside. A little pain on the right side.
Yeah.
The pain you know or another pain?
Just this way. And there's no other way.
No other pain. But it's the pain you are familiar?
아는 It's similar.
It's similar. Okay. Because now I made a provocation test for the external rotator, and this is very often that then arises the pain or a weakness of the muscle.
여기 이제 외성 검사를 했는데 통증 자극 유발 검사로서 자기는 사용을 했고 여기 자주 사용하는 것들 중에 하나로서 이제 위크니스나 페인을 한꺼번에 검사할 수 있다고.
And if you go in this position, yes, is there any pain?
No.
No. And if you make this, yes, it's okay.
I feel the
You feel
tightness of the muscle. It's straight.
It's
Yeah.
yes, this is normal, but not the problem, not the pain here in this area.
Yeah.
Okay. And if you make this, no problem.
Yeah.
It's okay.
Yeah.
Because this is external rotation, it could be also an irritation for the muscle when he has to work against the resistance of the internal rotation. But we have a little situation, we can reproduce it through the resistance test on the right side. Now on your front side.
통역 얘기하지 통역.
다 오케이 보고 있는데 일단 힘을 그렇게 강하게 저항을 준 게 아니기 때문에 익스터널 로테이션에 대해서 그래서 저항이 없을 때는 그렇게 통증은 나타나지 않을 수 있고 스티프니스 이런 거는 나타날 수가 있습니다.
Okay. About the treatment, the position of the patient. You are very free in this concept of IMTT.
이 IMTT 컨셉에서 어떻게 자세를 바꿀 건지는 굉장히 자유롭게 한데 제가 추천하는 거는 이런 상태.
We have to understand the basic principle and then to adapt from situation to situation.
기본 원칙을 이해하고 그 다음에 상황별로 다르게 적용을 합니다.
And the basic principle is the position should be without pain for the patient.
환자가 통증을 느끼지 않는 자세를 선택하는 게 일단 기본입니다.
And it should be comfortable for the therapist.
그 다음에 이제 치료사가 편하게 느끼는 자세로.
And this position is, if there is infraspinatus, it's very comfortable for me to press like this. I can also
요 딱 자세가 인프라스파이너투스에 제가 무게를 압력을 싣기 좋은 자세죠.
if the patient lies on the side, it's difficult to stabilize, and there is a big amount of effort to make that I can work.
또 옆으로 누우면은 이렇게 막 누르다가 균형 유지하기도 힘들고 굉장히 쓸데없는 자극들이 많이 들어가죠.
But if the patient doesn't feel pain-free and it doesn't feel comfortable on the in this position, we have to change on the side, or excuse me, you can sit the patient like this. In this position, you can work very well in the shoulder area if it doesn't feel comfortable on this.
요 불편하면은 방금처럼 바꿔도 됩니다.
Okay. So please feel free to adapt, and if there are questions you can ask. There are several positions, but this is easy and it works well. Okay, first we make palpation of the insertion and origin and insertion of the muscle.
네, 근육의 기시 정지를 먼저 찾고
I have to visualize where is the muscle fixed, because then I know the fiber direction.
섬유들이 어디에 붙어있는지 직접적으로 알기 때문에 자기들 이렇게 눈으로만 봐도 근육이 어떻게 생길지 대충 알 수 있다고 합니다.
Okay, I know acromion. Here is the spinal, medial border, angulus inferior. We have this triangle we just explored. Okay, and from here the muscle fibers go to the tuberculum majus of the humerus in this direction, in this direction, in this direction. This I have to visualize. Okay, so these fibers here on the lateral part goes in this direction, and the fibers here, they go in this direction. And you see, if I go perpendicular to the fiber, here I have to palpate in this direction, but here I have to palpate in this direction. I have to know exactly where, here, and here, and here. And I make first this overview examination. Where are the taut bands? And you hear the reaction. Here I feel, you can see here it makes plop. And it's very different from this part and this part. And this I have to explore here too. Here is a big, this is a very big taut band, and this is a small and strong taut band, and you can see the reaction of the patient is very easy to read and to know and where I have to continue. So I go to this taut band.
만지고 있는 지점에서
If it's too much, you say stop. It's okay. Here I can feel a very thin but pronounced taut band.
굉장히 얇고 이제 부드러진 타우트 밴드가 지금 저 지점에서 느껴지고
So first criterion is taut band. Second, I follow the taut band and we explore, is it equal in each part?
타우트 밴드 어딘지 찾고 아픈지 알아내고 다른 부위랑 같은 반응인지
And you hear and you see, I know where is the hot spot. Spot tenderness. It's
그래서
okay?
그게 스팟 텐더니스 아픈 겁니다.
It's okay?
너무 참지 말고 탭을.
Okay.
It hurts.
It remains local or there is an irradiation?
터지나요? 가만히 통증이 유지됩니다.
It little referred.
Little refer.
Yeah, to
Where?
to the deltoid.
You know this pain from your everyday life?
Sometimes.
Sometimes. So we have an active trigger point. Okay? Because he is familiar with this pain. If he would say, no, I don't know it, it would be a latent trigger point, and then I should look further and find a point where is it possible to make reproduction. Okay, I have an active trigger point, and now I practice just technique 1. I stay on the point and I wait. And I
기법
wait.
1은 지점을 찾고 누르고 가만히 있는 겁니다.
Pressure, manual compression of the point without moving is technique 1.
움직임 없이 가만히 있는 게 기법 1.
Most often I don't wait very long in this position. I start here to move a little bit.
체중을 더 싣지 말고 여기서 조금씩 움직여주는 겁니다.
You see I move in fiber direction. The pressure is constant. And the movement, is it big or little?
저를
The movement in fiber direction, is it a big movement or a small movement? Small movement, very small movement. Is it fast or slow?
Slow.
Slow, very slow.
하던 때는 수직으로 좀
Now, there are
할 때는
4 criteria for this technique too. It is a movement, and this movement is in fiber direction. In fiber
5가지
direction.
방향으로 또 조금씩 움직여주는 게 테크닉 2.
Second,
아니
파이브 방향.
그러니까
fiber.
근결 방향으로 움직여 주는 게 테크닉 2.
Fiber direction
Yeah.
of the muscle. I follow the fiber direction. The pressure is equal every time, and it's a small movement, and the movement is very, very slow.
그래서 제가 좀 설명을 드리면 테크닉 1에서 우리는 그 허혈성 압박을 한 게 테크닉 1이고요. 테크닉 2는 허혈성 압박한 상태 그 상태에서 조금만 근결 방향으로 조금씩만 움직여줘라 이 말입니다. 이 포인트를 놓치지 말고 다른 포인트를 이렇게 무지르는 게 아니라 그 잡은 거를 그대로 그 슬라이딩을 약간씩 시켜줘라 이렇게 생각하시면 되실 것 같아요.
Thank you for the support. You know it very well from the book, and so you can support me.
네.
How do you feel? More, less, equal? It's okay.
Yeah, it's okay. It's getting better.
It's getting better.
Yeah.
So the pain goes down. This is normal, and normal is about 10 seconds, 15 seconds, 20 seconds. Most often it starts to release the pain. This is normal. If it doesn't release, we remain, we wait for half a minute, for a minute, but then I have to change because my finger suffers.
그게 10분, 15분 뭐 계속 뭐 적용하면서 떨어지는지 아니면은 혹은 뭐 이게 남아있는지 리포트가 되는지 계속 물어보시면 돼요.
Okay. Technique 1, no movement. Technique 2, small, slow movement. Okay. Now, if I press here and we move the hand in this direction and in this direction, in this direction and in this direction. Is this technique 1 or technique 2 or technique 3? You think technique 3? Okay. I'm not agreeing. We will see. The analysis of the situation is pressure, no movement, technique 1. Pressure with movement, technique 2. And if this is a model, this would be the trigger point, technique 2 would be like this. And if now I change and he moves, I make this. So this is also a technique 2. But this we call technique 2A,
Yeah.
and this is 2B. I change punctum fixum and punctum mobile. Technique 2A is my finger moves, and technique 2B is my finger rest, and the tissue under my finger moves. I show it again. I go.
테크닉 2 같은 경우에는 이렇게 눌러주고 내가 움직이는 거, 2A 같은 경우에는 눌러주고 내가 움직이는 거, 그다음에 2B 같은 경우는 내가 가만히 있는데 환자가 이제 눈 좀 움직이는 거 하는 거예요.
Okay, I show it again. I'm on the point, and then I can move in fiber direction. This is technique 2A. Okay. Or I can rest here, and I can move the muscle, and the muscle moves under my finger, and this is also a movement, so this is 2B. And this I can make passively or actively or active assistively. All possibilities are given. Most often I facilitate this movement, and then I say, okay, please continue with the movement, In this direction, exactly. Yes, and you continue with the movement. Great, and you continue. So I practice this. So this is technique 2B. Okay. And pause. And then I can go away from the trigger point. It's not anymore a trigger point treatment in a sense. It's a facial technique. It's a release of the facial, of the muscle which has the, or I go in this direction. And you see, his spina is in this direction, so I have to go to follow this fiber direction, like this. And this I can make with one finger. This is very strong, the effect. Or I can make it with my knuckles.
엄지 손가락이나 너프를 이용해서 이런 식으로 긁어줄 수가 있는데 강한 압력으로. 근데 이거는 단연 트리거 포인트 기술이 아니라 이제 근막 기법이기도 합니다.
Here is important two things. No, three things. In fiber direction, but most important, slowly. Slowly, slowly. And with
근섬유 결대로 천천히 하는 게 중요하고
and with constant pressure.
압력을 지속적으로.
You see, I go deep, I rest deep, I go in fiber direction slowly with constant pressure. It's okay?
Yeah.
I can make it like this, I can make it like this. There are many possibilities. Slowly.
결과는 나 도움이
Okay. Questions?
Is there no problem if we apply this technique for direction like origin or insertion?
In both sides. Both sides. I showed it in this side or in this side. Both sides. It's welcome. Everything. Okay. So now please practice this.
근데 제일 처음에 저희가 타우트 밴드를 찾고 타우트 밴드 안에 트리거 포인트를 찾아 나가는 게 맞는지 한번 물어보세요.
맞지 않나요? 아니 그 말이죠.
그러니까 자꾸 이게 저희가 찾은 게 선생님 찾은 거는 트리거 포인트잖아요. 타우트 밴드 안에 있는 트리거 포인트인데 처음에 타우트 밴드는 이렇게 밴드가 타우트 밴드
Taut band
Yeah.
in this direction.
Yeah, yeah.
Here in this direction. But here
Yeah,
the
put a
taut
pipe-
band is in this direction. And technique 4 is in the direction of the fiber.
그러니까 타우트 밴드 안에 트리거 포인트가 있는데 그 트리거 포인트를 찾는 게 타우트 밴드를 계속 팔페이션 하면서 트리거 포인트를 찾는 게 맞는지.
Is there, if we want to find a trigger point in touch band, we must profession like this in only touch band, right?
Yes. In the diagnostic, first we
Yeah.
go perpendicular
음.
to feel the taut band.
음.
And if I have the taut band, I follow the taut band like this, like this, like this. Huh? First like this, and this in this and in this direction to feel the spot tenderness.
예, 예.
Okay?
Yeah.
So please diagnosis, you feel taut band, spot tenderness, and then you practice this 3 techniques, please.
자,
Each for 10 minutes, and then we will change.
타우트 밴드예요.